What is blepharoplasty? Well, blepharoplasty is otherwise known as an eyelid lift, and this can be done on the upper eyelids or the lower eyelids, and they're two very different procedures. So I'll start with an upper blepharoplasty, and usually that means taking off the extra skin on the upper eyelids that tends to be hooding over your eyes. You can also have fat protruding, mostly in the middle compartment here. And also you can have, that paired with too low of eyebrows, so sometimes it can be done in conjunction with a brow lift. Usually upper blepharoplasty entails making a small incision in the crease of the upper eyelid, and that gives me full access to everything I need. The lower eyelids are a bit more complex, so you can have fat protruding, causing kind of full, puffy lower eyelids, and the skin is perfectly fine and tight and there's no extra skin. So that fat that's protruding can be addressed in an isolated way, or if you have extra skin as well, I can trim the skin in that area. And sometimes there's just a little bit of extra skin, and that can be kind of a less aggressive blepharoplasty called a pinch blepharoplasty, where I literally just pinch the extra skin and remove it and leave a row of stitches underneath. What is recovery like after blepharoplasty? In general, it's not too bad. So on the upper eyelid, you'll have a row of dissolving stitches right where the eyelid crease is. You'll have some bruising and swelling, of course, which I'll have you ice your eyes afterwards. The stitches dissolve after about a week, and you can kind of fleck them off. They look like little hairs. And then the lower eyelid is very similar. So the incision is just beneath the row of eyelashes here. So after it heals, you can barely see it. If I'm only addressing the fat of the lower eyelid, that can even be on the inside of the eyelid, so you don't see any incisions. The incision, like any other on the face, will stay pink for a while, so I'll have you use sunscreen. And then once the color fades, you really can't tell, and the incision becomes nearly invisible. The eyelid skin is very thin, and so it heals well no matter what type of suture or technique you use to close it.